Good morning, Cosmic. Good morning, everyone that is on this call. It's so great to see such a large number of attendees on this call to talk about something that is extremely important. I want to thank you all for taking your Wednesday morning to join us for this lead safety symposium. And I'm excited to welcome everyone to this important gathering as we take another step toward making sure every home in our city is safe and healthy. And first, I want to express my gratitude to all of you who own and responsibly manage rental properties in Rochester. You play a vital role in delivering a stable, quality, and affordable housing for our residents. And as we tackle challenges like lead safety together, because we have to do this together, your partnership is essential to our success. In today's symposium and the upcoming in-person Landlord Resource Summit are designed to equip you with the information, tools, and resources needed to stay ahead of changing regulations while continuing to provide the high standard of housing that Rochester families deserve. And we understand that the new EPA lead paint dust clearance standards and the inclusions of HUD's port standards in our city's ordinance might feel overwhelming. These changes are essential for protecting the health and safety of our community, especially our children, from the harmful effects of lead explosion. So I want to assure you that the City of Rochester is here to support you every step of the way. That is what today is about. It's about information, it is about connecting, and more importantly, it is about supporting you supporting us, and us supporting each other. You always hear me say it is about we, not me. We can't do any of this without you. So we have taken proactive steps to support you because we know that responsible rental property owners like you are crucial to reaching our common goal of safe housing for all residents. With funds from the county, we added 6 new inspectors to our code enforcement team to ensure prompt assistance. Our Water Bureau is working to remove all lead service lines by 2030 at no cost to property owners. We're providing direct access to grants, financial resources, and technical guidance to help you meet these new standards. We recognize the challenges you face in managing properties, so we're committed to removing barriers, answering your questions, and more importantly, providing solutions that work for everyone. This is about partnership, it's about progress, and it's about prevention. You are our partners on this mission. And lead poisoning, as we know, is 100% preventable. And we know by working together, we can eliminate this danger from our community and make sure that every child in Rochester grows up in a safe and healthy home. So I want to thank you for your dedication, for being a part of the solution. In Rochester, we're so good at identifying problems. Anybody that comes to me with a problem, I'm like, okay, I heard it. What's your solution? We must be solution-driven in this city and stop just talking about the challenges that we have. So I encourage you to make the most of today's symposium and upcoming Landlord Resource Summit. Ask questions, seek support, and connect with the resources available to you. Today and the summit coming up should be all about connection with each other that are on the call, but also with the resources that you have here at the city. So together, we can safeguard our city's future and every resident across all neighborhoods, ultimately making Rochester a leader in lead safety. So I thank you again for being here, and I'll turn it back over to Mr. Reed.
Thank you, Mayor. At this time, I'll play a pre-recorded video from our county exec.
Good morning. Thank you for taking the time to join us today as we work together to make Monroe County a healthier, safer place to live. Thanks to the groundbreaking work of the Coalition to Prevent Lead Poisoning, our county has long been a leader in protecting children from the dangers of lead. The years of coordinated work by our Department of Public Health in partnership with the City of Rochester, the Coalition, healthcare providers, and community organizations, we've reduced elevated blood levels by more than 90% since the late 90s. But our work is far from done. Lead poisoning continues to affect our most vulnerable populations. Children under the age of 6 are at the highest risk. Not only are they most sensitive to the harmful effects of lead, but symptoms can be hard to spot. Just last year in our community, 241 children were still diagnosed with lead poisoning. That is unacceptable. The threat persists because Rochester has one of the oldest housing stocks in the nation. Nearly 90% of the homes were built before lead paint was banned. And so we continue to respond with action. With more than $5.7 million in grant funding, Monroe County has launched a three-part strategy to strengthen our efforts to prevent lead exposure before it happens. A lead rental registry, a leading in lead prevention pilot program that invests up to $40,000 per unit in home safety upgrades, and enhanced education and case management for families. But we need your help to be successful. The presentations today are bringing together experts who are ready to work with you for the good of our community. So thank you for taking the time to engage in this partnership. Together, we're working towards a future where no child in Monroe County is harmed by lead.
At this time, I have our Commissioner Dana Miller. He's going to speak about the community vision for lead-safe housing.
Hi, good morning, everybody. Can you hear me okay?
Yep.
Great. Okay, thanks. I really appreciate everybody joining us today. This is a very important topic for both the city of Rochester and for the folks who provide housing for people in the city of Rochester. I just want to talk briefly about Rochester's vision, or what we are trying to accomplish. You heard some of that from the mayor, you heard a little bit from the county executive, but just to talk about how we got here. I think that many people know that lead paint was something that was a standard for many years, starting all the way back in the 1700s. It was durable, it dried quickly, it's moisture resistant, but we now know that is the cause of severe health risks, particularly to children who are exposed to lead paint. And as the dangers began to become known with lead paint, governments began to take action. The manufacture of lead-based house paint was banned in the United States in 1978. So that goes back quite a ways, but most of the houses in Rochester were built between 1870 and 1950. So almost every house in the city contains some level of lead paint. And this is not a new problem. In fact, 50 years ago, when I was in high school, my first job was a program to test houses for lead paint. So we used a sodium sulfide solution. We went to houses, we tested them for lead paint on windowsills, and then reported out, what we found. So this is not a new problem. But the city of Rochester is dedicated to ensuring the health and safety of its residents by tackling the risks of lead exposure in housing and, as the mayor mentioned, in our water system. But we have a vision for lead-safe housing, but as the saying goes, a vision without action is just a dream. So we have to take that vision and put it into action. So one of the first things that Rochester did a long time ago, back in 2005, was to pass a lead law, which integrated visual inspections for deteriorated paint into our C of O inspection system for any housing that was built before 1978. And in high-risk areas, they also have to pass the visual inspection and a dust wipe test. So many of you have experienced that as you've gone through C of O renewals, to have your lead paint, have your paint tested for lead. And we've also encouraged the use of lead-safe work practices, and we've secured millions of dollars in federal housing and other funding to help landlords and homeowners address lead hazards. So we've taken some proactive action. The biggest thing was actually the change to our C of O responsibilities to make sure that we were testing for lead paint, but we've also provided lots and lots of funds to replace one of the biggest problems with lead paint, windows. So we've replaced lots and lots of windows to eliminate lead hazards. And as the mayor mentioned, we are currently working very hard on our lead service line replacement, recognizing the risk of lead in drinking water. We have been replacing lead service lines throughout the city. More than 8,100 lines have been replaced now, but we have a long way to go. We have about another 13,000 or so that need to be replaced. So we are continuing to do that. And we also are providing financial support and resources. So we've made significant progress. The percentage of children who have been impacted by lead has dropped dramatically, more than 70%. So that's a remarkable change that has happened because of a lot of the work that you have done and that we have done. So we've made significant progress, but there are challenges that remain. We continue to work on refining the laws, on finding programs and ways to respond to these changes, and to provide this ongoing commitment to achieve a healthier, lead-safe Rochester for all residents.
Thank you, Commissioner. At this time, we'll have a presentation by Scott Halleck with the Monroe County. So I will be sharing the slides. Got to see the presentation.
Yeah, we can see it. Thanks.
So I'll read this bio on Scott real briefly. Scott oversees the county's environmental health lead programs and bring over 17 years of experience to the role. As a U.S. Army vet, Scott earned an environmental degree in management from RIT and previously worked for the Army Corps of Engineers. Since 2018, Scott has led the county's effort to reduce lead exposure and promote environmental health. Scott, let me know.
Thanks, Cosmic. Hope everyone can hear me. Great.
Yeah,
Hi,
we can hear you,
everyone.
Scott.
My name's Sky Halleck. I'm Associate Public Health Sanitarian here in Environmental Health at the County Department of Public Health. I oversee our lead programs as well as Healthy Neighborhoods program and children's camps, which are in full swing right now. We're going to cover what we do here at the Health Department, basically our existing lead program, and then some new programs that we're working hard to implement. Next slide, please. Thank you. So the core of our program is childhood lead poisoning prevention. Our core program is required under public health law, and we identify children in Monroe County with elevated blood lead levels. And when we identify children, we then do medical case management and start environmental investigations for that child's case. And we'll talk about that in a little more detail. We also do a lot of community-wide education, outreach. We have a public health nurse that works directly with medical providers to do outreach specific to them. And then we're out in the public with, health fairs, property owners, contractors, all sorts of different groups out in the community. We also do respond to public complaints. When you're working on lead, you have to be properly trained and follow EPA rules. So we do some of that monitoring as well. Our program is completely state funded with grants. We currently have 6 sanitarians, public health sanitarians, an outreach worker, a public health nurse, a senior sanitarian, and myself. So at its core, we have to know what an elevated blood level is. In New York State, under public health law, it is required to get tested for children at age 1 and 2. So that when they're out there doing their wellness visits at 1 and 2, they should be getting lead tests. Those tests are collected in a statewide database. And then every morning we identify any test result in Monroe County, and we basically find if there is a new child that is over, and in New York State, it's 5 micrograms per deciliter of lead in their blood. So environmental investigations, what do I mean by that? So when we identify children, we identify where they live or spend a significant amount of time, and we will do environmental investigation at those homes. And we're really using a kind of a systematic inspection to identify all the lead surface by surface in their home, and then especially lead hazards. So where lead paint is not intact, it is a hazard and potential exposure source for those children. We use an XRF machine. There's a picture of one right there. It's actually the ones we use. And that gives us the ability to go surface by surface and identify the presence of lead. Even if it's covered with clean paint, we can identify the lead underneath it. And that's, we're not only identifying hazards, but we want to know where that lead is, so that owners are knowledgeable on that, in case they're doing work in the future, not creating hazards. When we do find hazards, we do issue a notice in demand. That's the start of a formal enforcement process, to require remediation of those hazards. This is a big team approach. We notify the city, DHS, property managers, landlords. We try to get everyone involved, to get resolution to these problems. We'll do field conferences. We'll meet landlords, property managers, contractors out on site to go over, specifically what we've cited, to make sure that the work is done correctly and they're working on the right things. When work is complete, we do EPA dust clearances. We want to ensure that the work is complete, it was done right, and then also it's clean. It's very important that when projects are completed, we're eliminating any source of lead dust in there. They have to pass the EPA dust clearance for the violations to be lifted. So, new things. The New York State Rental Registry and Proactive Inspection Program was passed into public health law in 2023. This is set to go into effect in November of this year. The state has rolled this out to 20 counties at this point, basically based on the highest rates where children had EBLs, and also concentration of old housing stock. In Monroe County, we'll specifically be launching this in the existing city high-risk area for lead. And what this will do is all pre-1980 multifamily rental units within that high-risk area will be required to register into a statewide rental registry database and have a visual inspection every 3 years. If there are lead hazards found in the inspection, they will be cited and remediation will be required. If no hazards are present, there will be dust clearance samples, and you will receive a lead safety certification. This is a huge lift. There's an estimated 21,000 units within the city high-risk area that this law is going to cover. We've been working behind the scenes to launch this, and we have formed a intermunicipal agreement with the city of Rochester. And using the funds we received, some grant funds to implement this, the city of Rochester will be doing the work. So a huge partnership. They'll be using their existing and new code enforcement staff to do this. The great thing is Rochester's already established their lead ordinance here. We believe the work is going to be very similar. There are some other big challenges here. It's a new law. We don't have regulations yet, and November's coming up very soon, but we really think we have the team in place and all the procedures to really meet this law. In conjunction with the rental registry is Leading in Lead grant. This is being administered by New York State Homes and Community Renewal. The county received a grant for this. And when they passed the rental registry law in 2023, the state also put some money aside to have a grant that could help when we cite people in the rental registry law. They have access to this grant now. So it covers pre-1980 multifamily units, just like the rental registry. and up to $40,000 per unit for lead abatement and remediation. We're really focusing that this is the first year of the grant. For the first year of the grant, it's a pilot grant. We're really focusing on units kind of in our case logs with children with EBLs. Um, um, the grant is for full abatement, so any friction surfaces in a unit will require full abatement. That means window replacements, door replacements, and then we will be allowed to do some controls on other surfaces. The county has contracted with Pastone to help us with that, and they're going to be our construction manager. We're actually hoping to launch this really soon. In the next week or two, we'll be sending out applications to units that are in our case history. And that is where I am. So thank you. We will be participating in the fair next week and welcome any questions. lead@monroecounty.gov is a great way to get to us directly. Thank you.
Thank you, Scott. At this time, Nicholas Wynn with the Water Bureau. He'll also be doing a presentation, and I'll read his bio briefly. Since joining the city of Rochester in 2019, Nick has led the construction of all lead service line replacement projects and water main rehabilitation efforts. As project manager, he oversees the replacement of over 5,000 lead-containing services, working directly with homeowners across the city to coordinate outreach, meeting, and access agreements. Nicholas began his career with the Water Bureau as an engineering intern, later earning his New York State Class D operator certification, a member of the American Water Works Association. He has presented on Rochester Lead Service Line Replacement Program and customer outreach strategies at statewide conferences. Nick, at this time, I turn it over to you.
Thanks, Cosmic. Morning, everyone. I'm Nicholas Wynn. I'm an engineer with the Water Bureau, as Cosmic mentioned, and I'll be touching on the city's goal of replacing all lead-containing water lines by 2030. So on the screen is just a touch base first. This is a diagram of a typical water service. Your water main is located underneath the street typically. And then in this presentation, I'll probably mention outside service and inside service several times. The outside service line is the water service portion that's connected to the water main out in the street and runs up to a shutoff valve, usually around the property line of the house. And then the inside service line picks up from that shutoff valve and runs into each home and connects to the water meter in the home. So some of you may have seen these notifications already. These are new notifications that the city's mandated to send out each year, or mandated by the EPA, just to inform all residents and homeowners if we do have record of them having a lead-containing service. Also, if we have record of an unknown service, we also mail out these letters. They are an annual letter that goes out. They're not meant to scare anybody. It's just a notification notifying you that you have a lead-containing service, simple steps on how to reduce lead exposure in the drinking water, and then some links with some more information, and then links to our website of where our projects are, and then just ways of reducing lead in the drinking water. So a big step we're taking is trying to identify those inside service line materials. The city has fantastic records for that portion in the public right of way, that outside service line. We don't have as good of records for that portion on private property, that inside service line. So we need homeowners, landlords, renters help in identifying what those materials are. So you can go online, that first link at the top cityrochester.gov/propinfo. You can navigate to the water tab and see what we have record for that outside line and that inside line. If you do have an unknown record for that inside portion, you can visit our website at cityrochester.gov/lead. You can follow the instructions to self-report what that material is. We have some pictures and instructions on how to help you identify that yourself. If you don't feel comfortable with that, there's an email address and a phone number on that website as well. You can contact us. We can schedule a day to send a technician out, verify what that material is. It's usually about a 5-minute appointment. It's rather quick. Just to go over those pictures, the picture on the left is a copper service coming through the wall. That was a self-reported one by a homeowner. The next two pictures in the middle and on the right are two galvanized services coming through the floor. There's a magnet that sticks to galvanize, so we can easily tell what that material is. And those are also homeowner reported photos. So now we'll move on to the actual construction portion in replacing those lead service lines. So just a quick criteria for how we select certain streets. We're obviously looking for a large number of lead-containing services on any given street. That allows us to replace the most amount of services with the funding we have. We typically look for water mains that are structurally sound and or have been previously cleaned and lined in the past. And then we're also working with our city street design division to choose streets that are up for a resurfacing project, because all the streets that are involved in a lead project will have a resurfacing project within 2 years roughly of that lead replacement. So these are some typical notifications that you can look out for. I'll start from left to right. So the left, once we have a project area identified, we've designed and bid out a project. We then send out public meeting notices. We hand deliver to all residents involved in the project area, and we also mail them to all owner addresses on file. It's just an invite to a public meeting, just give you more background on the construction activities that are going to take place. The next notification is an advanced construction notice, just again detailing the scope of the work of the project. And those notifications are usually delivered about 1 to 2 weeks before the contractor starts on any given street. Along with that advanced construction notice is a notice keeping your water safe, just some simple steps you can take to reduce the lead before and after the construction activities. And then the last notification on the right is just a notice of a water service shutoff. Those are delivered by the contractor typically the day before they anticipate working at a property, because the water will be shut off for several hours while we replace that lead line. So typical timeline for that lead service line replacement. The first thing, we excavate at that shutoff valve, usually in that tree lawn area between the curb and sidewalk. We identify what the material is for the outside service line and the inside service line. Once the outside service line is verified as lead, we'll excavate out in the street at the water main, and we'll run a whole new polyethylene service line from the water main, trenchless underground to that shutoff valve. The service line is then, that new service line that was installed is then flushed out. And once that inside service line is verified, if it is verified as lead containing service, the homeowner will receive an offer for the city to replace that at no cost. Along with that offer letter, we typically include a property access agreement that must be signed by the homeowner to allow us to work on private property to replace that inside service line. We deliver those to the residents, the physical residents that we're working at. And again, we also send those notices to the mailing address we have on file for the owner. We need that access agreement back, like I said, in order to allow us to complete that work on private property. And then once we receive that agreement, our contractor typically coordinates with the homeowner to find a day and time that works with both parties to replace that line, as they'll need access to the basement in the home for several hours to run a new line out. And once that service line is replaced, we typically drop off some educational materials for flushing guidelines once that service line is replaced. And then the surface restoration of that lawn area as well as the street takes place from there. So these are just some pictures summarizing the events. The biggest picture on the left is a street cut in the road. You can't see the water main in that picture, but that new line, like I said, is run underground, trenchless, up to that tree area where that pile of dirt is. The top right picture is the new polyethylene line connected to the water main out in the street. And then that picture on the bottom right is that polyethylene line running to that shutoff valve, typically by that sidewalk area. This is just another notice that we send out. This is the initial offer letter explaining that it's no cost replacement on that inside service line. Details a little bit of how that work will take place, typically 4 to 6 hours. The water will be turned off to allow that to work. And then on the right is a final notice. We're required to send out 4 notices in an attempt to replace that portion on private property. Again, we deliver those to the physical address we're working at, as well as send those to the owners that we have mailing information for. So you should receive one of these letters if you do have a lead containing service on that inside portion line. This is just some pictures summarizing that inside service replacement. On the left is that new polyethylene line running through the wall. They patch up that hole in the wall that they made to run the new line out. Patch that up. You can see the old galvanized line coming through the floor below that. And then just on the right is typically a galvanized line that's been downstream of a lead service, and it's just got some built up corrosion on the inside. This is the post replacement communication. Every address that we replace the lead service line at, once the replacement has taken place, we leave a Brita filter pitcher. It reduces 99% of the lead after that replacement. We drop them off at every single house with that important notice, just detailing those guidelines for flushing, as well as this notice that will be in that bag, a post-lead line replacement guidance, just again explaining the next 90 days flushing that is recommended on cold water before drinking or cooking with it. Just because construction activities can temporarily elevate levels of lead for up to 1 to 3 months. So these are the recommended guidelines on how to reduce that. And we say the 5 to 10 minute flushing on cold water. I know a lot of people raise concern that raises their water bill. Typically, a 5 to 10 minute flush is less than a penny, if not a penny, to do that. So it's the most effective method we have of reducing the lead levels. And then after replacement, if there's any concerns or problems, they can be reported to our Water Bureau dispatch. That's a 585-428-7500. Our dispatch is staffed 24 hours a day, 7 days a week, 365 days a year. So if there's ever any issues, you can give them a call and they'll be able to dispatch the correct person to help with the issue. And then the city does offer free lead water testing to all residents, homeowners within the city limits. That is offered 1 to 3 months after the construction, so those levels can kind of settle out. And then there's the phone number and email address for how to contact our lab to schedule that. That information is also on our website that you can find if you want to schedule that lead test. And then finally, this is also on our website. This is just a dashboard tracking live data for the work we've done so far. So as I mentioned before, we don't have great records for that inside service line towards the left side, towards the bottom. You can see we have over 16,000 unknown service lines on the inside portion. So we really do need help identifying those. And then the next thing, we just ask for your patience. We have just under 16,000 lead containing outside services to replace. So we're continuing to get funding in to replace these. We just ask for your patience as we go neighborhood to neighborhood in replacing those service lines. And that should wrap up my end of the presentation.
Thank you, Nick. The next presenter that we'll have is Albert Algarin, who is the City of Rochester lead paint coordinator.
Good morning, everybody. Thanks for joining. Before I start, I do want to let everybody know that any questions that you're putting into the Q&A will be addressed at the end of our panel discussion. We just ask that you keep the questions and that they pertain to the subject matter that we're going over today. My name is Albert Algarin, as Kazmik said. I am the lead paint program coordinator for the City of Rochester. I've been a city employee for over 20 years. And I have been in code enforcement for over a decade. I first want to start off, before I get into my presentation, by letting everybody know on this call that I know that these changes can be difficult to kind of go through the process with. And we are completely understanding of that. Anybody that has any questions, my information will be at the end of my slide. If I can help you in any way to navigate the process, I know these changes are new, although our lead ordinance has been around for quite a while. But these changes are a little bit different than what we've done in the past. So being understanding of that, and as Mayor Evans said, it's a partnership, right? And it takes not just landlords, sometimes it takes tenants and city staff to kind of work together to get through some of these difficult hurdles that are in front of us. But the end of the road is always what we're looking for is child safety, right? And tenant safety and providing safe housing for our residents in the City of Rochester. And I know that's landlords' main goal as well. So if we can help you in any way, please reach out to me and we will see what we can do, case by case scenario. Next slide, please, guys. So in my presentation today, we'll be going over a few topics, an open porch standard that we've adopted from HUD, some of the impacts of Public Health Law 1377 on our city processes, some operational changes that we had to undergo, and what you can expect during a lead paint inspection for your C of O. So the City of Rochester adopted an open porch standard. And what this means is if there's deteriorated paint on a porch, it needs to be corrected, as always has been. But if it's over the allowable levels, a proactive dust wipe will need to be done by a third-party company. It's one wipe, and this is inside and outside the high-risk areas. We have small building components, which will be trim, window sashes, handrails, spindles, columns. If those are in excess of 10% of peeling paint, it falls into this category. We have large building components, which is the wall of the house, the window trim of the house, underneath the porch roof structure, within the porch envelope, the ceiling, and the porch floor. Those all are encompassed as well. And if any of those surfaces are over the allowable levels, they will require a third-party test. If the property has more than one open porch and there's deteriorated paint on multiple porches, then there will be a one wipe required for each porch. These are on properties built before 1980, and this is something new that we kind of underwent. And there's a few reasons. Where there's been some studies done to show that there's some pretty large amount of lead dust that can be on open porches, especially since lead is atmospheric. Within the city limits, a lot of times you see children, hanging around on the porches, right, playing. There might have been an abatement project that was done. Construction debris might have been left on the front porch. All that stuff can contaminate. So we really need to make sure that the porches are painted before we get there. There will be no enforcement during the winter months on this because we understand that during the winter months it's a little hard to paint. It's hard for it to stick and it's hard for it to be durable and last. So as long as there was no enforcement done previously during the winter months, we will be treating it as we would treat any sort of exterior deteriorated paint, and it'll be weather deferred for the C of O process. Next slide, please. Okay, so requirements to resolve the violation. As I talked about, we will need you to have a third-party company come out. These are the same third-party companies that we use for our interior testing. That is the only way we'll be able to abate the PC 809 violation. That's a violation that you will see on your notice and order. It'll be under PC 809, and that will give you some verbiage there directing you on what to do. In order for it to pass the clearance report, it needs to follow the HUD standard. So it needs to be under 40 micrograms per square foot. And as I said previously, only one wipe sample is required for each porch flooring surface that is in violation. And the most critical thing of all this, and not just exterior, but interior as well, is cleaning. I'm going to go over some of the EPA numbers that have recently dropped. And it's been kind of difficult for some, for people to get to pass. So we created a cleaning video. You can see the link in here, and we will share the link in the chat. That cleaning video will take you through a process to show you how to clean properly to prepare for your lead test. Nothing guarantees the pass of a lead test, but it will, if you follow these instructions, increase the chances of passing your lead test. When it comes either to a City of Rochester inspection and our city staff doing the wipe, or if it's an independent third-party company doing it, it should follow the same process. Casman, go ahead. Okay, Scott Halleck from county, our counterpart here, talked about some of this, but I'm going to go over kind of some of the things that will impact our process. So New York State came out with a Public Health Law 1377. This caused quite a big changes in our program, and we really kind of had to go back to the drawing board and pivot and see how we can meet the requirements of what we know so far. So before I get into this, please understand that during this process, nothing has been finalized. So I'm only going to speak to what we know. I'm not going to speak to speculation. We want to wait until the state finalizes the regulations to really get all the information out there. We don't want to cause any confusion or any anxiety for anything that may not happen. So we really want to stick to the meat and potatoes of what we know. So what do we know? We know that the state established a rental registry for residential dwellings built before 1980. This is for multi-residents, so 2 units or more. The state is going to require that a certification of lead safe conditions for qualifying rental properties. So once you get your test and everything passes, there has to be a document to prove that. It mandates that we do proactive inspections every 3 years. This includes a visual assessment and a dust wipe sampling. This only applies to properties inside the high-risk area for interior violations. As I said, the owner must submit an inspection certification to the local health department by October 1st, and this is annually. Encourage coordinations between housing and health agencies to enforce compliance. And the law takes over on November 3rd, 2025 of this year. As I said, regulations have not been finalized. So as we get more details, we will go through that with everybody and get some communications out there to let everybody know, okay, these are the final regs and this is what's going to happen going forward. Next slide, Casman. So when this happened, like I said earlier, we had to pivot, right? We knew that we were going to be doing a lot more wipe testing. So we had to increase our staffing. So as of right now, we've hired 6 employees, 5 new property conservation inspectors. And these 5 property conservation inspectors is a title that we brought back. Actually, it's a title that I started with in code enforcement, where I would only do lead testing and we would cite trash and debris and high grass and weeds. We eliminated that from the title, and we have inspectors out there that are solely purposed to do lead testing and to help with any sort of lead related issues. In addition to those 5 property conservation inspectors, we hired a full-time senior service representative. Her name is Lovely Hall. She's on the call. She's been fantastic. Along with our PCIs, they've all been great. Everybody's super eager to learn and to help, and I cannot be happier with the staff that we hired. Lovely is helping take over some of the data entry, kind of frees up that for me so I can be out in the field more with the inspectors. And she's also helping out any residents' inquiries, has my lead test pass, and any sort of information that you would need as far as lead testing goes. When we heard about this coming down the pipeline, we started immediately. So we started biweekly planning meetings with Monroe County partners, Scott and his team, Megan and Star, and we have been pounding the pavement, meeting in conference rooms, virtually, however we can do it, to try to figure out how to get ahead of this. And we're in pretty good shape. We're in pretty good shape. This is a big undertaking for a lot of counties. The good thing about Rochester is that we have a certificate of occupancy process that was already established. So we're able to get into homes. The more homes we're able to get into, the more lead hazards we're able to identify and rectify to ensure that we're keeping children safe in our community. Casmic, next slide, please. In addition to these changes, we also had a change from the federal government. So Environmental Protection Agency lowered their clearance numbers. This has been a big undertaking because the numbers have dropped. So it's made it a little bit more harder for somebody to pass a lead test. In order for a floor to pass a lead test, it needs to be under 5 micrograms per square foot. And in order for a windowsill to pass, it needs to be under 40 micrograms per square foot. And in order for a window well or trough, it needs to be under 100 micrograms per square foot. This is why cleaning is going to be so important when testing is done. We can't wait to clean after the first one, after the first initial wipes are done, because if you fail half or more of your samples, it's an automatic third party as well. That's why we need to have everybody try to clean as much as you can before we get to that property. Cleaning should be done 1 hour before your appointment, so it gives time for dust to settle and for surfaces to dry. But if you clean and follow the instruction videos that we have, it will help your chances and reduce chances of failure for dust wipes. Next slide, please. Okay, lead safety testing protocols for our pre-1980 properties. As I said, a visual lead hazard inspection is required for all residential units before 1980. When we do our lead testing, we always start with a visual first. We need to make sure we document and see what the paint conditions are so that we can figure out which fork in the road that we're going to take from that point. If it's under the de minimis levels, and there's peeling paint, it will be cited as a cosmetic violation. So you will see something like a wall violation or a floor violation or ceiling. If it's above it, then we will cite it for a deteriorated paint, and that will trigger a third-party inspection. If it's below it and it's within the high-risk area, we're going to ask that those conditions, if they're peeling, are corrected as long as they're below the de minimis levels, and our city staff will come in and do a proactive lead test for you, as we've always done. All rooms in the unit that have direct access to that property, those will need to be inspected for your visual. So if you have an attic that has direct access, we have to get into that attic to make sure there's no deteriorated paint. If there's a basement with direct access, we have to get into the basement to make sure there's no deteriorated paint. If it's a common basement or if it's a common attic or a common hallway, and there's deteriorated paint in those rooms, it will still be cited and it will still need to be corrected, but it will be corrected and abated from a visual standpoint, not testing. But if it's direct access to the unit, then that would have to be corrected, and then that unit would have to be tested for dust wipes. For properties outside the high-risk area, dust sampling is not required unless peeling paint or other concerns are observed during the inspection. So if you're outside of the high-risk area, nothing changes. If we get there and your property is built before 1980, which used to be 78 and it still is until November 3rd, but once November 3rd comes, it will be before 1980. And if we get there and during the inspection we see deteriorated paint above the de minimis levels and you're before that threshold of construction, then a third-party lead test will need to be required. If it passes the visual inspection and it's outside the high-risk area, then a third-party lead test will not be required. It will be cleared through a visual and you will be all set. Next slide, please. Lead inspections for the C of O. So dust wipes are always collected up to 4 rooms per unit. We understand that some apartments don't have 4 rooms. You might have a smaller 1-bedroom, but usually we can get up to 4 rooms. In each room, we will take one floor sample and one window sample. If you have a old style wooden window, we will be testing the well or the trough. If it's a replacement window, we will be testing the window sill. If a wipe fails the clearance threshold, targeted retesting will be conducted for that specific area. So if we go there and let's say we do samples in 2 bedrooms, a living room, and a kitchen, and the living room window is the only thing that fails, as long as you can get our inspector back in there within 30 days of the notification, then we will only specifically test the surface that failed. We will not test the rest of the unit again. If you don't get us back into the unit within those 30 days, then you're going to have to go through a third-party company, and that third-party company is going to require that you test the entire unit again. So if you have a failure and we notify you, please do your best to try to get us into that unit within 30 days so we can do the testing. If half your samples failed, then or more, so let's say we did 4 rooms, there's 8 samples within those 4 rooms, and you have 4 or more of those that failed, it's an automatic third party, and you will have to go through a company to get the test done. Again, clean. Cleaning is the biggest subject that we can push here today. Lab results typically take within a week to get back to us, sometimes a little longer depending on the lab and how busy they are, sometimes a little less. You can always call the office or speak to your inspector to see where we're at with results, and we are pretty good at getting those cleared as soon as we get them. So within 24 to 48 hours of receiving the report, we should have that cleared from your case. Next slide, please. And that's the end of my presentation. If you have any questions, again, my name is Albert Elgarin. My information is on the screen, my email, my phone number. Please reach out. And if there's anything that I can answer throughout the Q&A, I'd be happy to do that as well. Thank you very much. Kazmik, back to you.
Okay. So at this point, we're going to go into our panel discussion. I will be reading the bio for Dr. Kaufmacher, Elizabeth McDade, Dave Raleigh, and Johanna Santiago. Scott and Nick, they're part of the panel as well, but I've already read their bio. So once I've completed reading the bio, we'll go straight into our discussion. So Dr. Kaufmacher is a leading policy scientist and community engaged researcher. She co-directs the NIH, NSF, Lake Ontario Center for Microplastic and Human Health, and has spent more than 20 years working across environmental justice topics, from lead poisoning to air quality. She holds a PhD in environmental studies from Duke University and is author of Bridging Silos, MIT Press 2019. Elizabeth McDade. Elizabeth brings nearly 2 decades of experience in environmental health, coalition building, and lead poison prevention. A longtime member of the Coalition to Prevent Lead Poisoning, she holds a certificate in RRP, healthy homes, and hazard assessment. She also consults with URMC and contributes to health studies, including CARE and Rock Home. Gabrielle Gonzalez. Gabrielle is a community-centered environmental scientist who advocates for disinvested communities through education policies, legislation. She holds a Bachelor of Science degree in environmental science from Portland State University. Dave Raleigh. Dave Raleigh has managed water operation for the city of Rochester since 2014, oversees treatment facilities, water quality initiatives, and city accredited lab. He leads the Rochester Water Bureau Lead Task Force, ensuring compliance with federal regulations and spearheading lead service line replacement effort, recognized with the Mayor Emeritus Awards in 2023 and serve a leadership role in New York State section of American Water Works Association. Dave was appointed in 2025 to the New York State Drinking Water Quality Council. Prior to joining the city of Rochester, Mr. Raleigh spent decades with New York State Department of Health and over 12 years in engineering consultant. He holds a civil engineer degree from RIT and is a licensed professional and is certified as a grade A1 operator. Johanna Santiago. Ms. Santiago is a bilingual public sector that has over 24 years of experience in housing, municipal operation, and contract management. Johanna oversees housing rehab and demolition programs, manages multi-million-dollar budget, and ensure regulation compliance. Rising through the ranks from clerk to manager, she has shaped housing policy, enhanced neighborhood stability, and leads a cross-functional team. Her expertise span grant management, procurement, and community development. And that is the bio for our panelists. I'm not sure if any one of the panelists want to say anything before we kick off with the questions. But he's all set. So the first question goes to Gabrielle. So Gabby, the question is, what role does landlord education and outreach play in reducing lead exposure among high-risk tenants? And what more can be done to engage rental property owners in these efforts?
Can you repeat that question, please?
Sure. What role does landlord education and outreach play in reducing lead exposure among high-risk tenants, and what more can be done to engage rental property owners in these efforts?
Yeah, I think it's really important to do direct outreach to people and let them know what's out there, give them all the resources we possibly can, let them know how serious lead poisoning truly is, because a lot of people, they move into homes and they're unaware that lead is a serious issue, and that maybe sorry, I saw the chat. I didn't know if Katrina had to jump in.
No.
Okay. Yeah, just giving people the resources that we can and letting them know that that there's people there to support them.
Okay. All right. Thank you. Katrina, the next question goes to you. What are some of the latest findings in lead exposure research, and how might they shape future policies?
Wow, that's a really big question, and I would love to talk about it for a couple of hours. However, I see there's some really great questions in the chat, and I want to leave lots of time for that. So overall, I think what's important to know is that we've known lead is bad for us for thousands of years. And I talk about that as like we've known it's bad for workers and drinkers. So that early on, we know that people who worked with lead got lead into their systems and got really sick. And also people, Romans drank out of containers that were made of lead and they got really sick. And that's important context because the way we think about lead has typically been high exposures to high amounts of lead. Now, for hundreds of years, we've known lead is particularly bad for kids, and especially thinking about exposures in their homes. And then more recently, we've learned that lead is even worse at lower levels for more people for longer than we had. And I like to present that super quick historical timeline because many of us have in our heads that as long as you are protected from really severe exposures to lead, you're fine. But in fact, the science shows us that the most damage to our brains as a society is from really low levels of lead. So for example, we've learned from Rochester research done in Rochester that there is no safe level of lead for kids. we've learned that in addition to making it interfering with how kids' brains develop, it interacts with stress and lots of other environmental contaminants to harm people. When I say more people, we know it's also damaging for pregnant women, for babies, not just kids, but adults as well, and in more ways. So most recently, research has come out showing that lead probably makes a really big contribution to heart disease for people of all ages, to dementia, to osteoporosis throughout the lifespan. So in terms of policy implications, we've known lead is bad, so that's pretty straightforward. We've always known lead is bad. But because we now are realizing that it is really, really bad for kids between the ages of 0 and 6 and unborn children, but also at lower levels for everyone, I think we're going to see more policies that not only address the biggest source of lead exposure, which is lead in housing from paint and dust, but also other sources of exposure like the water that Nick was talking about and consumer products over time.
Thank you. Thank you. Next question goes to Scott. What are the biggest challenges in conducting the elevated blood level investigation, and how can they be overcome?
Thanks, Cosmic. Honestly, one of the biggest challenges is just gaining access to units. Once we've identified a child, it's really important to contact them. We have some timelines that we have to follow, but we usually follow up with families as quick as we can. And then just stressing the importance of getting access to their unit to identify hazards if they're there. Overcoming that is, a lot of education up front, explaining the importance of identifying those hazards and eliminating them. And then establishing communication between everyone involved. So that'd be a tenant, a landlord, property manager, contractor. It gets even more complicated if we get into the unit and identify hazards, because now we have to fix them. So making sure the tenant and the landlord are on the same page, and scheduling work, getting the contract in there, and making sure it's done okay. So communication and gaining access, that's the key.
Okay, thank you. Johanna, how does HUD's lead abatement grants assist property owners in making homes safer for residents?
So the city's lead hazard control program, as Cosmic mentioned, it's funded by the HUD's Office of Lead Hazard Control and Healthy Homes. The funding helps property owners make homes safer by offering funding and resources to address lead-based paint hazards in their homes. The grants are used to cover for, inspections done through a lead inspection risk assessment by an EPA certified lead risk assessment form, and for controlling hazard, including removing, encapsulating, or enclosing lead-based paint and cleaning up contaminated dust and soil. The grants are usually targeted homes occupied by low-income families, especially those with children under the age of 6. As we all know, children are particularly vulnerable to the lead exposure. These grants are essential in safeguarding residents' health and reducing lead related injuries and illnesses.
Thank you, Johanna. The next question is for Elizabeth. How does collaboration across different sectors enhance the fight against lead poisoning?
Good morning, Cosmic, and thank you to everybody for all of the great information that's being shared in this webinar. Cosmic, it's critical, right? Collaboration is critical. One of the reasons why this community has actually seen the reduction in children reported with lead paint poisoning is because of collaboration across multiple agencies, multiple sectors. Certainly the research provided by the University of Rochester, and we can tie that into Katrina's work. The health department deals with health issues. The city of Rochester deals with housing issues. So if you don't have cross collaboration, if you're not collecting data and analyzing it, if you're not working, to solve a health issue with a environmental approach, you're not going to solve the problem. And so Rochester has actually become a gold standard. And that's not our words. Those are words other people have used about how this community collaborates and continues to collaborate, right? Over 20 years, we're still having monthly meetings to address how to do this work. And in fact, this type of collaboration has actually spawned other initiatives that are doing similar types of work. So it is absolutely critical, and it has been the linchpin to how our community's been able to make see the successes that we've seen so far.
Great. David, this question is for you. When the lead service is removed, does that mean that lead is no longer a risk in my drinking water?
That's a great question, Cosmic. In fact, that does not necessarily mean that all of the sources of lead plumbing that could be in contact with water in the home have been removed. A lot of Rochester's old housing stock not only had lead paint, but up until 1986, brass fixtures and solder that was used to hold copper plumbing together didn't really have any restriction on how much lead could be in them. So fixtures and lead solder can be the sources of lead in drinking water. So just because the lead service line is replaced, it doesn't necessarily mean that all risks have been mitigated. Now, the lead service line tends to be the largest contributor, but that doesn't mean that some other mitigation shouldn't occur. And, you know, the good news is for homes that don't have a lead service, mitigation is as simple as letting your water run a little bit in order to flush out the water that's been sitting still in your pipes in contact with those lead-containing components. Think of it like a train station. When the train is stopped at the station, a lot of folks can get on. So when that water is sitting in your pipes overnight, the lead can dissolve into the water. So that first bit of water that you draw in the morning or after you've been gone at work all day still has some lead in it that it picked up from your plumbing. But our testing shows that if you let the water run anywhere from 2 to 5 minutes, you typically, and you don't have a lead service, you will see no lead in the drinking water at that point. So that's why our guidance for everybody includes, if your water's been sitting, let it run for a few minutes, or take a shower, flush your toilets, things like that. Normal water use tends to turn over the water in your plumbing enough that it's mitigated. For those who are still concerned, there is always a simple filter you can get in order to remove lead from drinking water.
Thank you, David, for that. The next question goes back to Gabby. How can parents and caregivers advocate for stronger lead safety regulations in their community?
Yeah, I think parents and caregivers are definitely some of the best advocates, truly. And I think being an advocate and engaging in politics at any level can be really intimidating. But truly, the politicians and the people that are in our government and in places of power, we put them there. So I always try to remind parents and caregivers that, like, these people are here to listen to you. They are here to support you. That is literally their purpose, their one singular purpose. So go directly to them at any point if you feel like something's not being enforced properly, or you see, like, my mom was on the street and she saw that somebody was taking paint off of an old home. And it was very obvious that it was lead paint, and all of that was chipping off and flying all over the place. Like, when you see that, you gotta say something about it. And maybe the person doesn't even know. Maybe they're a contractor that was unaware. But just being engaged at every level, even if it's the smallest level, like a PTA or a community board, just being engaged really shifts the conversations. It builds community, and it really educates you and others about what's happening directly in your community.
Thank you for that. Katrina, the next question for you. Can you explain how lead poisoning affects cognitive development in children and what interventions show promise?
Wow, I get some really giant questions here, and would love to follow up more. There's information that is readily available on the internet, on our website, on the health departments. But overall, I think that I try to remember that lead fools the body. The molecule of lead looks like calcium to the body. And we know calcium is really important for lots of functions of growing brains and bones and the rest of our bodies. So when a child gets lead into their body, and I'll talk about how that might happen in just a minute, that lead can enter cells and interfere with all kinds of processes. And that's why we know that it has so many impacts on health. So Commissioner Miller said that the number of kids who've been impacted by lead dropped 70%. That's true in terms of what we can measure, but actually all kids in the city have been affected by lead. All of us have been, because lead is in our environment. And we've discovered that it can still have effects at really low levels. And that's why it's so important. The reason we focused on kids is that when that lead gets into kids' blood, it gets into their brains, it affects the branching of their neurons so their brains don't develop right. And that's not something that you can fix later. So you also asked about interventions, right? What can we do if a child does get lead poison? And unfortunately, the tragic answer to that is not much, because once a child's brain is formed, if it has been affected by lead, that's how it is for their whole lives. So there isn't a specific cure or a pattern of impact or an intervention for once a child is lead poisoned. However, there are a lot of strategies that parents can use to lessen the effects and make sure that the children thrive throughout their lives. Those look like the kinds of interventions that we make for kids who have trouble learning and behavioral issues for other reasons, like ADHD. Unfortunately, the supports that we tend to put in place, like special education and one-on-one attention and smaller classrooms, are the expensive things that are generally cut when schools have budget problems. So all of these things are connected, from exposure to lead to children's success in school and our ability to do something about them. I think that's the best answer I can give you, but I did see a question in the chat. So I wanted to let you know that there are lots of ways that lead can get into our bodies. One is through the skin. That's not so common anymore since we don't have lead in gasoline. It can be inhaled, so if you breathe it in, and then it can get deep into your lungs and enter the blood there. Or most commonly ingested, so accidentally eating it. And for kids, I use my hands because kids get lead on their hands from crawling around and touching things, and then they accidentally swallow it. And from there, it can get into their bloodstream, and the blood carries it to their brains and their bones, and all the other systems that I mentioned can be affected negatively by that exposure.
Oh, thank you for that answer. Thank you. Scott, next question for you. How do you ensure that affected families receive timely and effective remediation services?
That goes back to a lot of communication again, and education. It's really, once we've identified hazards, really connecting with landlords, property managers, contractors, and the tenant to make sure, scheduling what the work actually has to be done. And that goes both ways. Some of that's on us, how quickly we respond and get out there and identify problems. And then communication with the owners and contractors. We also like to identify any resources out there to help owners, if it's available. We try to do that as best we can. And we do have enforcement mechanisms. If projects are really slowing or not moving, we can do formal enforcement, which can involve hearings, fines, and things like that. We don't like to do that. We like to have owners use their resources. We don't want to implement fines if we don't have to, but that is a tool.
Right. Gotcha. Thank you. Johanna, I have one more question for you. What steps can local government take to maximize the impact of federal lead prevention funding?
So the city has been doing a lot of teaching to property owners. So I would say to continue to educate our residents and the property owners on the dangers of lead, the signs of the exposure for lead, and then the steps for prevention. I would also say to continue to ensure property owners are in compliance through our code enforcement unit and pursue additional resources to maximize funding to enhance and expand our lead program.
So when you say like with the with code enforcement, is it that it helps property owners if they have property that are, I wouldn't say they're semi-compliant to an extent that they can get some funding? Is that's what you're saying?
Correct.
Elizabeth, I have one more question for you. What successful effort has your coalition undertaken to push for stronger lead regulation?
Well, I hope Katrina and Gabby will chime in if I forget one. So the coalition has essentially been working to advocate for stronger regulations since its implementation over 25 years ago. We certainly got the lead ordinance included into the certificate of occupancy inspection. We have a lead safe schools policy that's in the Rochester City School District. We've been working with great organizations like the one that Gabby represents, Lead Free Kids across New York State, to make sure that we are trying to not only look at legislation that's going to impact our own community, but also the lessons that we've learned, and then taking those lessons and trying to make sure that all children are being safe. So we've been working on national work as well. When the Centers for Disease Control stopped funding their lead program, we immediately started activating and trying to get that reinstated because that is impacting the entire nation. Luckily, there's been some movement back into that, so fingers crossed that continues to be there. I would love Gabby to talk about some of the great stuff they've been doing statewide, and just want to say that the coalition serves to be an advocate. That is really and truly the basis of the organization, always trying to make sure that we are trying to figure out ways to keep children safe and adults safe from exposure to lead paint hazards. Gabby, do you want to add in a couple little bits there?
Yeah, we also try to advocate for budget stuff. So like GAP Fund, which is the Green Affordable Pre-Electrification Fund. So as people are trying to electrify their homes, we want low-income homes to also be included in that movement, which also means a lot of older housing stock is going to be renovated and lead paint is going to be disturbed. So we want to be able to get lead paint out, make sure the home that's being renovated is done in a safe way, and have funds available for everybody along that whole process. And yeah, just connecting people together all the time, because the more people can talk about their experiences and validate each other, the better.
And we also try to make sure, by the way, we're informing our elected officials about what's really required, right? Like not just sort of a pie in the sky idea, but what's actually needs to be done for the people who are doing the work, like all of the terrific people representing the county and the city on this call and all of that hard work. We try to actually not only share the data and the resources that everybody's doing, but also advocate to make sure that our elected officials understand the full gamut of all of this, because there's a lot going on with that and what it really means to make sure that these laws are in place. So lots of work on all of that. It's a great question. Thanks, Kazmik. A lot of stuff happening that you don't see.
Thank you. Thank you for the answer. David, next question for you. As it relates to the lead service line replacement, how is the project funded, and what financial assistance is available for homeowners who need their lead service line replaced?
That's a great question. The city has been very fortunate thus far to get, I would say, 95% of the funds that have been expended towards lead service line through grant sources. That has included New York State Water Improvement Act funding. It has included ARPA funding from the I think it was 2021 now, probably $40+ million worth of ARPA funding. And we have so far qualified for 3 straight grant allocations from the bipartisan infrastructure law. So for the most part, this program has been successful in getting done with little to no impact to ratepayers. Now, individual homes, what we are doing, and I think Nick explained it, as we are going through the city and programming these projects, we are identifying whether or not the service line that is on the private side or on private property that enters the home needs to be replaced. And at that time, we're offering to do it at no charge. So there's no need to sign up for this program, but I would encourage anybody who is curious about it to pay attention. You'll get notices when a project is coming to your neighborhood, and pay attention to your mail. You'll get pre-construction notices. We have public hearings, and if your service is identified as one that needs to be replaced on private property, on your property, then we will be reaching out to you because you'll need to execute an access agreement to allow us to come in and do this free of charge. So for those of you who want to figure out whether or not you have a lead service, that information is available on our property information website. So fortunately, thus far, this project has had little economic impact on ratepayers, water customers in the city.
Awesome. Great. So I'll do another set of questions to each one of the panelists, and then we'll just go into the questions that have been posted in the Q&A. So Gabby, one more question for you, final question for you. What initiatives has Lead-Free Kids New York implemented to address disparities and lead exposures among marginalized communities?
Yeah, so we try to approach it kind of with legislation and policy, and also through grassroots movements and education, because for the policy pieces, it can be really slow. And even if a bill gets passed, then the implementation can take a while. Like, we've been advocating for Public Health Law 1377, but the actual process of rolling out those, the draft regulations and the implementation is taking a while. So as that is all being rolled out, we have to also be educating communities, seeing where there's spikes in elevated blood lead levels, and going to those communities and kind of seeing why is that happening and how can we tell people, like, this is the source, this is how you deal with it. Like, in Syracuse, they saw a lot of elevated blood lead levels, and they realized it was because of their water. That was one of the sources, but it's also in their housing and in the paint. So we have to tell them to be careful of their water and get filters for that. And also, and like distributing those filters, we've been trying to help out with that. And also telling them that there's some surfaces in their homes that are probably high friction surfaces, and maybe their children shouldn't be in those rooms, or they should be encapsulating those cracks in the walls somehow. And then through the policy, like I already mentioned, the GAP fund, and we also try to get money for health departments so that they can be functioning well, and really trying to talk to legislators in those areas that have high risks of lead exposure, letting them know that that's still an issue in their community and they should be addressing it, because there is a lot of turnover in staff in these offices, and sometimes they just genuinely don't know that lead is still an issue. That's something that we consistently run across when we're talking about lead. Legislators will be like, didn't we fix this like 20 years ago? Like, no.
Katrina, thank you for that, Gabby. Katrina, final question for you. What gaps in current research exist, and where should future studies focus to better address lead poisoning prevention?
Well, I may get in trouble for saying this because I'm in a toxicology department, but I don't think that we need more toxicology research. We know lead's bad for us. We know it's bad for us at low levels in many different ways throughout the lifespan. I think the most important research is on solutions. And I'd like to give you one story to explain that. Rochester is a leader in both lead research and policy. Like, we have one of the toughest assignments out there. We have older housing with lots of lead. We have low margins for property owners so that they have relatively few resources to address that problem. And because that, for the last 25 years, we've been trying to come up with innovative, low-cost solutions that really work to address that problem. And we've been so successful in doing so that the Rochester system is now used as a model for the whole state and for many cities across the country. I think that between us, the coalition, and the city, we've talked with dozens and dozens of cities about how to address this problem there. But that doesn't mean we're done. I've seen lots of questions in the chat that have given me ideas for new studies that need to be done. And I just want to share this one story about why it's so important to get it right. About a year and a half ago, one of my staff told me that she had heard from a tenant that their next door neighbor was having the outside of their house repainted in preparation for a city inspection. And she saw them standing and generating lots of dust, which, you need to do before you paint, including on the porch. And she didn't want to say anything to her neighbor because that would be awkward and, maybe endanger their relationship. And she said, I know the city's got a good lead law. And so they're going to make sure that that house is safe before my child goes over to play with his buddy who lives there, including on the porch. And our previous research has showed that lead dust on porches can be a big contributor to kids' blood lead levels. And I knew that the city's lead law didn't actually address lead on porches. So we took that information, and the city has recently adopted this lead porch standard to avoid that situation. That's a really good example of how important it is to get it right, to study what actually happens, and then to respond. And so thank you for all of the questions in the chat that will give us ideas about how to keep doing that going forward.
Thank you, Katrina. Scott, next question for you. What roles does code enforcement play in addressing environmental lead hazards, and how can it be improved?
Enforcement is a key piece for us. I mean, we are the regulator in this situation, and when we're identifying hazards, we start with a formal notice and demand. That's really the start of our enforcement action. And that carries some weight. It's a formal thing under public health law. And ultimately, violations are subject to fines. Like I said earlier, we don't like to fine people, but it's up to $2,000 per violation per day it exists. We certainly do enforcement if it's necessary. So it's a big tool, but like I said, we like to have owners use those resources to actually do work. But we do enforcement. Like I said, we're a regulator, and it carries some weight. So it's important for people to understand this is a formal process, and hazards need to be fixed.
Okay. Yeah, thank you for that. Johanna, what qualifications must municipalities or individuals meet to access lead abatement funding?
So the funding through HUD's Office of Lead Hazard Control and Healthy Homes is a competitive application process. I will say that over 20 years, the city has been successful in obtaining the funds. However, eligibility is determined by a number of factors. One can be including like the type of applicant, whether it's the city, the county, the health department. Municipalities may be eligible for a certain grant category depending on the number of occupied housing units built before 1940. Another requirement or possibility that can harm eligibility is previous grants, the status of them, how it would impact HUD's decision in funding the programs. Now, as far as homeowners, the way they can access these programs is through whoever applied for the grant. So in this case, it would be the city of Rochester. So they're required, if there's an income restriction. So residential properties that are privately owned and built before 1978 are eligible for the funding. Like I said, homeowners are required to meet an income requirement, and so does the tenants have to meet income requirements. Properties that have young children or pregnant women, as well as those located in areas with a high risk of lead poisoning, are prioritized. The property owner has to be current with the city and the county taxes, and for some instances, for rental properties, they are required to pay 10% of the overall project cost. So that's basically the, eligibility for homeowners to apply for the city's grant.
Okay, thank you for that. Elizabeth, what barriers still exist in eliminating lead hazards, and how can we work to address them?
Well, that's a huge question, and I'm sure everybody on this call could add to the list of what their perspective on how they're going to do this comes. But I will say it's about education, right? It's about understanding that even though we eliminated, legally lead from paint in 1978, which is probably before most of the people on this call were born at this point, we have to continue to do this, right? We live in homes that are older. We live in homes, we have beautiful housing stock that was all painted way before 1978. So part of it is making sure that whenever we hire anybody to do any work in our pre-1978 homes, we are hiring somebody who is RRP certified. That's a federal law. That's renovation, repair, and painting certification. You have to do that for anybody who's disturbing 6 square feet on the interior or 20 square feet on the exterior of your home, regardless of the work scope. You want to make sure they're RRP certified. I'm actually having my house painted right now, and I found the guy who's RRP certified, and you can believe that if I'm going to be talking the talk, I'm going to be walking the walk. We also have to make sure that we're in compliance with the laws, right? We have panels of people who understand the value of this, what you can do to make sure that you're proactively, right? Don't be reactive in this work. There's no point in that. Be proactive in terms of identifying where there are lead hazards. If you don't know if there's a lead hazard there, just presume there is and work accordingly, right? That's a simple way of just assuming it's there and work accordingly. Lead is a hazard for children, but it's also a hazard for adults who are doing any of this work. The long-term health effects, we kind of touched on them briefly, but it is a permanent issue that has long-term health impacts on anybody who gets exposed to it. So making sure that you're reducing your exposure is significant. Making sure all children are tested for lead in accordance with New York State law, which has been on the book for decades, at ages 1 and again at 2. 100% of children should be being tested for exposure to lead, regardless of where they live, at ages 1 and again at 2. But being proactive about this, we have tons of resources in this community, making sure that we are trying to pay attention to it, making sure that we understand that it is not something that's going to go away. As Katrina said, this has been lead is an element. It's in the world. It's been in the world for centuries. It's not going to disappear. We have certainly reduced the impact, but we have got to continue to work to make sure that we are utilizing all of the tools in our toolbox, and we have a lot of them in this community, a lot more than other communities, which is really a sad on another issue, but making sure that we are proactively doing this and that we are communicating that with others, right? Like, new parents are having children, people are moving into this community. They don't realize what the resources are. They don't realize what the laws are, all of that stuff. So understanding that we're sharing all of this information so that we all can utilize the tools that we have at our disposal is one of the ways that we're going to reduce the impact of lead hazards.
Great. Thank you for that. And final question to David. What measures are in place to ensure the long-term safety and effectiveness of the newly installed water service lines?
Well, the materials we're using should last over 50 years. But what we are doing I talked a little earlier about lead in household plumbing that, we don't have the ability or authority to mitigate. What we are doing is we are undertaking a corrosion control study right now to identify treatment options that we have that we can implement to further reduce the way our water interacts with lead-containing plumbing. When I say reduce, I mean reduce the amount of lead that our water can dissolve. So what we're in essence doing is testing a bunch of different treatment chemicals and seeing which might be most effective to help keep the lead that's on household plumbing on the plumbing and not in the water. We are hoping to round that study out about a year from now and then take the findings of it and add additional treatment to our process in order to mitigate those risks to the best that we can, short of removing all the plumbing that has lead in it. So.
Awesome. Thank you so much. So I want to thank all of you panelists for the information that you guys have provided thus far. Regarding the Q&A, so for the next 20 minutes, we have a few questions that we're gonna try and address that were posted. So Albert, I believe you're seeing those questions. So if you just want to read them out, and then from the panelist standpoint, whoever you think, Albert, is more would be able to answer. If not, just throw it out here, and whoever want to answer can answer.
Sure, thanks, Cosmic. Before I do that, I would just like to extend a big thank you to Mayor Malik Evans, County Executive Adam Bello, Commissioner Dana Miller, all of our presenters, all of our panelists, all the staff behind the scenes that are nobody can see, and everybody's kind of working and scrambling. Everything is run smoothly. And to you, the landlords on this call, if you're on this call, you care and you want to do the right thing and you want to be informed, right? And that's our job, is to make sure that you have the tools and understand where to reach out to and who to reach out to get some of these things accomplished. They're not easy tasks, and we understand that. And again, I go back to what Mayor Evans said. This is a partnership. Rochester is very rare when it comes to what we do with lead and code enforcement. For a municipality to have a partnership, a city municipality to have a partnership that we have with Monroe County and our coalition to prevent lead poisoning, is rare, right? You don't see that in many states or cities. For everybody to kind of work together and to have an end result where we can just, make sure that children, right? Because this is about children, not just and as Elizabeth said, adults can be impacted too, but we're really, really concerned about the children here and making sure that they have a safe home to live in. That partnerships that we have, I believe, is where the rubber meets the road and why we are so successful. So a big thank you to everybody that was part of this event, and I greatly appreciate it. So I will go on into some questions here, and I'm going to answer some myself, and then I'm going to shoot it out there, and whoever from the panelist group thinks that they're best to answer, please jump in and answer what you can. So one question that I'm going to answer for myself is, how is the new lead testing regulations different from the city's current policy of testing during the C of O process? And that's a great question. The big impacts are the new numbers that have been lowered. So we are going from a set of clearance numbers that were once previously approved, and now we have the EPA has dropped their numbers down, and New York State is saying we have to follow what EPA does. So those numbers being dropped are great, right? Because it ensures that we're trying to move in the right direction to keep lead free from children. So that is a big task during the C of O process. And that's where I kind of keep pushing in there about cleaning, right? Cleaning, and preventative maintenance, right? If you have a C of O for 6 years, you should be in that property more regularly than just waiting for the 6-year time to pass and then meet the inspector at the property. Because during that time frame, a lot of things can change, right? And paint can deteriorate in that, especially if you have a portion of the house that gets beat up by the sun or the wind. Those sides tend to deteriorate a lot more often. So preventative maintenance is something that's going to be huge for landlords, along with cleaning, to make sure that we can get through this process and get you approved C of O. Also, one of the things that we've done that we've changed is we've gone from an 8x9 template for the floors that we've used for our dust wipe, and we've moved to a 12x12 template. So it's a little bit larger of a surface that we're sending up to the laboratories as far as dimensions go, to show, that we are what the dimensions are for what we're wiping. So the template was improved, was enlarged for that. The window template is still 2x18 template. And pretty much everything besides that is for the interior portion is the same process. A visual inspection will be first and foremost. And based on that visual inspection, whether you pass or fail, then the next steps will be proved from there. So if you fail the inspection, then you will have to have a third-party company come out and test your property. If it was built before 1978 and come November 1980, that's in or outside the high-risk area, doesn't matter. Inside the high-risk area, you're required to have a dust wipe no matter what. So if you pass your visual inspection within the high-risk area, the city's going to come out and we're going to do it for free. We're going to test it twice if you fail. And then if you fail the second time, or more than half or more of your samples fail, then we will then you will have to go through a third-party company. So that's the answer for that question. Let's see here. Let me get another question here. Is there a website that outlines the zip codes considered the high risk for multifamily use? Yes, there is. So just to touch base on that real quick, our high risk area will be changing slightly come November. Okay. We are possibly taking a little bit of Center City out and expanding a little bit into the southeast. Information will come once November comes, but right now, the high risk area, if you go to the city website, it's on there. It's a map. And not only is there a map, there's a better tool that I like. It's actually the street listings. So it will break down each street that is in the high risk area. And on top of that, if there is a street that borders the high risk area, let's say Clifford Avenue, for example, if a portion of Clifford Avenue is in that high risk area and a portion is outside the high risk area, it's going to break down the numbers from the houses. So, numbers 1 through 240, for example, could possibly be in the high risk, and anything outside of that is outside of the high risk. So the map is great, but the street listings, I think, is a better tool to use. It's on cityofrochester.gov. If you just type in lead into the keyword search or high risk area, it'll bring you to it. And if you have any problems finding that, just reach out to me and I can get you a copy. That's no problem at all. This is for question for Johanna Santiago. Larry Bedgood asks, last year I tried to obtain a grant for window replacement. The tenants didn't have all the proper ID and paperwork in place, so I couldn't get the grant. How can I get the grant this year? Johanna, can you help answer that?
Yes. So unfortunately, we would still need the tenant's documentation and income and ID. The grant, we have to determine that that the tenant meets the income guidelines. This year, we are going to be applying for another lead grant. We won't know till later on in the fall whether or not we were awarded to it. So right now we don't have any grant funding for that, but more than welcome to follow up with our office anytime after this the fall.
Thanks, Johanna. This question I believe is best geared for Dave Rowley. Jenny Gemgemi asks, if a letter was not received about the inside line looking like it was lead, is there somewhere to check to see if a letter should have been sent or was just not received?
Absolutely. So we have our entire service line inventory available on the city's property application or property information application on our website. So if you go there and find your address and then click on water when it pops up, it will tell you both what we call the outside service, which is what's on the public right of way, and the inside service, which is the pipe that goes from the sidewalk into your home. That will tell you what the service line material is. If you do that and you see that it is rated as unknown, you can follow some steps, excuse me, that are on our website to either identify the service line yourself or make an appointment with us at the Water Bureau. The information's on our website, and we'll actually send somebody out and identify that service line material for you. That will help us make sure we do get you included in the projects. Now, what we do is anyone that is unknown, we try to find that information out as we develop projects so that we're not missing anybody. So, but that is a good way to check. We do a pretty good job of making sure we're getting everybody, but it never hurts to have a second set of eyes. So we welcome folks using that tool. And then if there is a discrepancy in what we think it is, we're happy to come out and identify it.
Thanks, David. This question is from Daisy Algarin. I might know this person. Does the coalition work with nursing schools on education? Katrina or Elizabeth, if you can jump in on that one.
Yeah, I don't think we have any direct interactions with the nursing schools, but there are a lot of programs that are based at the University of Rochester, which is the home of the Western New York Lead Poisoning Prevention Center and the Finger Lakes Center for Children's Environmental Health, in addition to our center, to help work with providers and parents on lead poisoning prevention.
I will also just share that the coalition will go and educate wherever we're invited. We've done grand rounds in the past, and our coalition chair is a family nurse practitioner. So we have tried to integrate as much as possible with whoever wants us to come and talk, we will come and talk and do that. So yes, but no. So
Thanks, Elizabeth. Okay, this question is for Scott Halleck with the county. This is from Bob Thompson. Are there any requirements to test areas that are frequented by children outside the home, such as daycares, public, and charter schools?
So yes and no. We don't directly regulate daycares. The health department. What we do is if a child is identified with an EBL, we do an environmental investigation. Part of that investigation is identifying where that child spends a significant amount of time. So if that child is in daycare or spending days at relatives' house, we then conduct the same inspection as the primary unit in those units as well, including daycare. There is also a regulation for lead in schools. So schools are required to test their drinking water every 3 years now, and there's a limit there. If they detect any lead, they test every fixture that someone can drink out of in the school. And if they get above the action limit, they have to take that fixture out of service and replace it or take it offline. So there is water in school testing, but we don't directly do peeling paint and stuff. I believe the city school district internally does look at lead in schools. They have their own health and safety person that does that.
Thanks, Scott. I'll field the question next. It's been asked a couple of times. What is the high-risk area? So the high-risk area is put together based on census tracking and elevated blood level cases, right? So we try to target the areas that we see a past trend in children being poisoned. And if we can see that happening, then we know which areas to go out and test in, right? So our high-risk map covers, I would say, don't quote me on this, maybe 70% of the city, if not a little bit more. So we have a good chunk of properties that we are in testing proactively. So we just want to make sure that we're just not out there willy-nilly testing random properties, right? We want it to be purposeful. We want to make sure that we're driving down numbers in certain zip codes that we see cases being built on and high incident rates on those, and make sure that we're addressing the targeted areas of concern. Scott, if you have anything to add to that, or nope? Okay. You said no?
No.
Okay. All right. Thank you. This can be for maybe Katrina. Has there been any studies on adult vaping in households as it affects children? Recent studies have shown vaping devices have immense amounts of lead.
Not that I'm aware of, but that's one of the examples where I thought, oh, the questions in the chat are giving me some great ideas. I will look into that one. We do have a Center for Research on Flavorings in Tobacco and Vaping Devices. And I know that people who smoke cigarettes have elevated lead levels, but I don't know any studies on vaping. So I will look into that.
Katrina, correct me if I'm wrong, but burning lead actually makes it more poisonous, correct? Like if you heat it up and you're inhaling it that way, it's actually worse than paint. Am I incorrect in general on that one?
No, well, as I mentioned before, you can get lead into your body through your skin, through inhaling it or ingesting it. And inhaling it is probably the most direct to get into your blood. So yes, having it volatilized is really bad. And that's part of why there are such strong controls against using heat guns to get leaded paint off housing.
Thank you. Let's see here. There's a question about will we get the printouts of all the slides? So this is being recorded and it will be posted onto the website, our cityofrochester.gov website. So if you need to go back and follow along on anything that was missed, a pre-recording will be there for you. And this way you can, kind of catch up on anything that you weren't able to capture during the event. Let's see here. When do you count 3 years? If I had a lead inspection at a home 6 months ago, a year ago, is it since then or is it since the introduction of the new lead law? It's a great question. So we count the 3-year cycle from the moment the clearance test passed. So if we received a clearance test today, July 23rd, 2025, that clearance will be good until July 23rd, 2028. The only thing that can change that is if our inspectors get called out to the property for a potential complaint, or if, whatever reason we're in there and we do observe that new deteriorated paint has been, developed and not been addressed. And if it's cited, then it will null and void that clearance report and corrections will have to be made again. And then a new clearance would have to be done. As long as the property was built before 1978. And again, I say that until November 3rd, because that will change in 1980. So that is how we track the lifespan of a clearance lead report. I think we have time for one more question. Let me see here. This one is for Johanna. If a landlord has a violation in one house, do you prevent them from registering in another house to request help in replacing the windows?
So to receive the city grant, the landlord has to be in compliance with all of their properties. So if you do have other rental properties, they are required to be in compliance with code enforcement on that. So yes, it'll prevent it.
Thank you, Johanna. I will leave a couple of minutes for any of the panelists or presenters if you have anything else you would like to say before we sign off here. If not, then I will turn it back over to Casmic.
Nothing from the panelists?
I just want to say thank you to everybody for, as Albert said, I just want to echo that. Thank you to everybody who's signed up to learn more about all of this. And thank you to everybody who works so diligently. I was telling somebody the other day, I said, this group of public servants is a truly dedicated group of people trying to make our community better. And it's always a pleasure to work with you and to try to figure out how do we collectively solve problems that we can't do by ourselves. So thanks to everybody.
Thank you, Elizabeth. I'll just add that as a reminder that next week, the 31st, from 2 to 4 at the Convention Center, we'll have the resource fair, as was mentioned early on. We'll have city staff as well as our partners as well, as it relates to lead. So just a reminder to come out and engage, ask questions, and If not, I thank everybody for participating and see some of you guys next week. All right, have a good day, everybody.